According to the CDC, a parasite is an organism that lives on or in a host and gets its food from or at the expense of a host. There are three main classes of parasites that cause disease in humans: protozoa, helminths, and ectoparasites. Of the parasitic diseases, malaria causes the most deaths globally. Cryptosporidium is a microscopic unicellular parasite approximately 4 to 6 micrometers in diameter, as compared to a bacteria like E. coli, which is 1.8 micrometers in diameter, that causes diarrheal disease, cryptosporidiosis, commonly referred to as crypto. It is classified as a protozoa. Many species of Cryptosporidium infect animals, and some can even infect humans. Cryptosporidium parvum and Cryptosporidium hominis are the most prevalent species causing diseases in humans. The Cryptosporidium life cycle is very complex, and just as a snapshot, I have included the picture that the CDC provides on their website. While crypto can affect anyone, there are a few groups that are more susceptible than others. People with weakened immune systems, such as those with AIDS or inherited diseases, cancer patients, and people who are taking immunosuppressant drugs like transplant patients are all more at risk. The side effects of housing a cryptoparasite generally begin anywhere from 2 to 10 days after becoming infected. The most common symptom is watery diarrhea. Others include stomach cramps, dehydration, nausea, vomiting, weight loss, and fever. These symptoms usually last 1 to 2 weeks, and only occasionally do people experience a reoccurrence. Crypto lives in the intestine of infected animals or humans. The parasite is shed in the stool. Millions of parasites can be released with each bowel movement, and the shedding can begin as soon as symptoms appear. Crypto can be found in soil, food, water, or on surfaces that have been contaminated with feces from infected humans or animals. Crypto can be spread by drinking recreational water contaminated either from sewage or the feces of animals, eating undercooked food contaminated with the crypto, or touching your mouth with contaminated hands. This can occur from touching surfaces, caring for an infected person, or handling an infected animal. The CDC website suggests one way to prevent crypto is by practicing good personal hygiene. This means washing your hands, applying clean running water and soap, lather and scrub for at least 20 seconds. You can also avoid water that might be contaminated, such as lakes, rivers, ponds, or streams.
The full name of our next parasite is Cyclospora catenasis. Cyclospora is a single-cell coccidian parasite, a group of parasites that affect the epithelial cells of the intestinal tract in humans, dogs, and cats. The parasite spread through the consumption of water or food that's contaminated with feces that contain the Cyclospora sporulate oocytes. Sporulate oocytes ingested by the host cause cyclospiralysis by affecting the epithelial lining of the small intestine. After Cyclospora undergo their life cycle in the host, fully mature unsporulated oocytes pass through as a bowel movement and need days or weeks at 22 to 32 degrees Celsius to sporulate and become infectious to a new host. Host-to-host transmission is unlikely. For human host, transmission of this parasite is common from untreated or contaminated water and/or raw produce that was exposed with this water. This contaminated water results from human sewage and feces that has not been properly treated. Subtropical regions is where cyclospora contamination tends to occur. However, imported produce to the U.S., such as fresh raspberries, basil, snow peas, and mesclun lettuce, which are handled and/or transported from regions in South America, have been implicated with U.S. outbreaks of cyclospiralysis since the mid-1990s. Symptoms of cyclospiralysis begin 7 days after ingestion of a sporulated oocyte and include watery diarrhea, nausea, fatigue, and muscle fatigue as its most common symptoms. Less common symptoms include vomiting and low-grade fever. If a person is not treated, these symptoms can persist for several weeks or longer, and some can resurface, especially the diarrhea. Infection by cyclospora is not normally life-threatening, and healthy individuals will normally recover on their own. If it is needed, antidiarrheal medication can be taken to alleviate some of the symptoms. Unhealthy individuals may find that illness progresses longer but should still recover on their own. No effective antibiotic regimen has been discovered or utilized.
Created using Powtoon.
Now we're going to talk about Giardia. Giardia is a genus of anaerobic protozoan parasites that colonize and reproduce in the small intestines of several vertebrates, causing the illness known as giardiasis. Giardia were first described by the Dutch scientist Antony van Leeuwenhoek in 1681. Their life cycle alternates between an actively swimming trophozoite and an infective-resistant cyst. Giardia is found in contaminated soil, food, or water, including lakes, streams, and rivers that have been contaminated with feces from infected humans or animals. People become infected with giardiasis when they swallow the parasite. Acute symptoms include dehydration, nausea and vomiting, diarrhea, and abdominal cramps. Giardiasis can be spread by drinking contaminated water, eating uncooked food that contains the parasite, or having contact with persons who are ill with giardiasis, especially in child care settings. Several drugs can be used to treat giardiasis. Effective treatments include metronidazole, tinidazole, and nitazoxanide. Giardiasis is a global disease. It affects nearly 33% of people in developing countries, and in the United States it is the most common intestinal parasitic disease affecting humans.
Created using Powtoon.